And joining me now, infectious disease expert, Dr. Nahid Bhadelia of Boston University. Dr. Bhadelia, welcome back to Meet the Press. What's your reaction to what Governor Hutchinson just said and the failure of a national strategy on face coverings at these rallies?
Well, Andrea, thanks for having me. You know, we've done this natural experiment a couple of times now. We know that when we go back to living like we're not living in a pandemic, we end up with more cases. And those end up in more hospitalizations, which lead to more deaths. As you might have seen, Texas, Arizona, and South Carolina are seeing their 7-day average of deaths now pointing upward again. So how do we move forward, right? The other thing that we've noticed is when we overwhelm the system with too many cases, we, by necessity, start having shortages, inability to respond. In states that are hard hit, what you're seeing is delays in testing. You are seeing inability to get enough personal protective equipment. So our system is not responsive enough. And not only that, but then we're leading to a fallout on everybody else's health. When hospitals get overwhelmed, when healthcare workers get overwhelmed, it basically affects everybody else's health. How do we move forward? We need this national strategy. The strategy has to be, we need to drive the cases down. As you heard Governor Murphy say, as you heard Governor Hutchinson say, we have to coexist with this virus. We need to create that buffer space. It's a point system. Every activity, almost every activity we take during this pandemic carries risk. When we don't wear masks, when we have large gatherings, we're taking away from that social tally. We're basically increasing society's burden of this disease. And so we as a society have to make those choices. What do we value more? You know, fall is coming, schools are opening, we're having this discussion that carries its own risk. We're looking at providing care for patients whose care has been delayed during the pandemic. We now have to divert those resources again to COVID-19 in areas that are hotspots. We have to make a choice as a society about where we're going to expend that energy, where we're going to allow that buffer so that we can continue the important aspects of our culture, our civilization.
And the European Union is such a great contrast. They have more than 400 million people, a greater population there than we have. Yet take a look at this graph and the fact that theirs has come down. They have about 3,500 daily cases. We're now up to 55,000 daily cases. What are they doing right, particularly in places like Germany and France, highly industrialized countries, compared to us?
Well, they started off with a strategy that we pursued at the very beginning, but we seem to have abandoned after Memorial Day, which was the point was to drive the cases down to such a level that then you can track every chain of transmission. So New Jersey's doing that, right? They're able to find any new cases, hopefully, that are coming into their state. That's the way that you move forward. You put the resources in for testing, you put the resources in for contact tracing, but to begin with, you need to start with a place where you have so few cases that you can do that, because once there are too many cases, contact tracing can't keep up either. You know, and so and the other strategy is, because we didn't pursue that initial stop, getting to a point where lower cases so we can break chains of transmission, we're now in a position where we opened and we have to close again. The counties that are hardest hit, they have no option but to close again. And that's even more painful for the economy. It's even more painful for those businesses, as you mentioned.
The president keeps talking about the fact that we have massive testing, yet the Harvard experts say that we are testing only half as many people as we need to be testing, as well as he's pointing to the fact that these cases are producing fewer deaths and that younger people are being affected. Is he wrong?
Yeah. Well, he's wrong in the fact that testing leads to more cases. Let's start there. I think that we are not testing enough, and the reason we know that is CDC has estimates that we're basically catching 1 in 10 patients who might have had this disease, looking at serology studies that look at, whether or not you had immunity and you were exposed in the past. So if you take it from there, what does testing do? If this was a war, we wouldn't say we don't want the intel, we don't want more intel. If this was a flood, we wouldn't say we don't want the survey of the land and to try to figure out how bad the damage is. Testing allows us to find more people in the community. More people lead to more cases. It's as simple as that. Finding those cases allows us to break those chains of transmission. But look at the advantage that it has for the individual patient. If you get diagnosed early and you're somebody who's high risk, you're able to come to care early. Maybe we can improve the mortality. Yes, we are testing more, and so thankfully we are finding younger people, but younger patients do not exist in a vacuum. They work alongside, they live alongside people who are vulnerable. We need to keep younger patients who are vulnerable safe as well. So testing is an advantage both as a national strategy, but also for the individual patient, and we can't forget that.
Dr. Bhadelia, thanks so very much. Thanks for being with us.
Hello from Washington, I'm Chuck Todd, and thanks for checking out the Meet the Press channel on YouTube. Click on the button down here to subscribe and click over here to watch the latest interviews, highlights, and other digital exclusives.